This week at the Rangiora Vet Centre, Sophie demonstrates how you can check your own pets for lumps and bumps at home.
So today we're going to talk about lumps on dogs and cats. We're using a dog for this example, but it's important, and a lot of the same principles apply to cats with issues as well. So we're talking about how to check your pet for any lumps, where to look, and what to do about it if you find a lump. So this dog is probably about 10 years old. Obviously, the older the dog gets, the more chance there is of it developing lumps. It's really important that when you're just petting and playing with your animal like this, to feel all over them. So run your hand firmly down their body and feel if you can feel any little lumps or bumps. If you can feel something and you think, oh, what's that? First rule is to check the other side and see if you can feel it on the other side. And if there's two of them, generally it's probably a normal lump that you can feel. In female dogs, whether they're spayed or unspayed, it's really important to check the mammary area. Dogs can get breast cancers, the same as people, so you need to run your hand firmly down underneath their tummy. You need to check and find their little nipples as well. This dog was spayed quite young, so her nipples are really quite small, so you can't even really see them, but you need to have a good feel. The other place to check for lumps that's really important is around the throat and under the chin. This is where we get a lot of lymph nodes and glands. And basically there's a lot of loose skin in a dog as well around here, so it's just good to give it a good old ruffle and a good old feel and make sure that everything feels smooth. And don't be afraid, you're not going to hurt your dog by having a good feel. Most of them quite like it, and you can kind of combine it with a good pat and a good rub at the same time. The other place is lumps they can get on their legs, and obviously they've got joints. And they've also got lumps obviously on there as well, some of those are normal. If there's a lump over a joint and the dog's a bit lame, that could indicate something more like an arthritis rather than an actual skin or tissue lump, soft tissue lump. This particular dog, I was checking her the other day and we came across a tiny little lump just there. So I'm going to talk to you today about what we would do in the first instance of investigating whether this lump is just a benign lump or whether it's something more to worry about. So when we're looking at dogs, the lumps can be anything, and there's no way to tell from looking at them from the outside as to what they are. The only way to say whether they're a cancer or they're just a benign lump is to take a sample. And the first step that we go through to try and diagnose what they are is we use a process called fine needle biopsy or fine needle aspirate. This process is normally quick and painless for the dog and the cat, and we can do it in a consult like this. We take a sample using a tiny little needle, put it onto a microscope slide, and then either look at it ourselves in the lab or we send it away for further examination. From that, hopefully we'll get an answer as to what it is. If it comes back inconclusive, the next step is normally to do an anaesthetic and a biopsy. And it's really important that we know what that lump is before we even think about considering to remove it. A lot of people say to me, and I completely understand, why don't you just chop the lump out? And we get that a lot. However, it's vitally important that if that lump is a nasty type of cancer, that we remove it in the most appropriate way, which sometimes involves taking a big margin around it. And if we just remove a lump willy-nilly and send it to the lab, there's every chance we could leave some cancerous cells behind and risk further spread of the disease through the dog.
Next week, Sophie shows us the ultrasound machine and takes us through the process of performing a scan.